a bit early on the 1 minute. Yeah, my name is Anne-Maria Newham. I am the Executive Director of Nursing, HPs and Quality, and we've let John Bruin have a day's leave. We've been really generous. We felt that he's worked hard for the last year and he's deserved a break. So I'm doing this today, but I am joined by a really, really fabulous bunch of execs. My colleagues, I've got Clare Teeney, who's the Executive Director of HROD. I've got Julie Attfield, who's the Executive Director of Local Mental Health Services. I've also got I've got Yolanda. I can't just see a picture there, but I've got Yolanda, who's the Associate Director of Comms as well. So with much further ado, I'm going to give you a couple of notices, and then I know that we've had some questions that have been sent in as well. So firstly, I just want to mention the Oscar nominations. I know that you'll have seen it on Connect and on Facebook. And our comms team tell us that they are so impressed with the amount of nominations they've had so far. However, they want to encourage us to continue to do those nominations. And the closing date is the 5th of April. And honestly and genuinely, this is your opportunity to nominate people who have gone over and above and you feel need that recognition. Some people have done some fantastic work over the last 18 months, 12 months. And really, it's about just saying thank you and recognising that. Also, it's this week is World Autism Awareness Week. So it was just a big shout out to such an important area, and also an important area for us as a trust as well. I wanted to mention uniforms. I know that a lot of you have heard me talk about uniforms over the last 6 months. We've had a project that's been running since May 2020. We've completed that project, and really it was about looking at how many uniforms we have across the organisation and standardising the approach to what uniform different groups wear. So we've gone from having 178 uniforms in the trust, and we've got it down to 24. However, I wanted to let you know that on Tuesday, we are launching the communications around that. So on Tuesday, you will see a big communication plan go out with some really, really lovely infographics and really good explanations about what people will wear. It won't be immediate. There will be a transition. Of course, there will be. We won't expect people to suddenly, on the 6th of April, all change. There'll be a 6-month transition from what they were wearing to what they will be new wearing. But the comms will come out on Tuesday, and there will be an opportunity for people to contact. We'll have an email address for people to contact if they've got any concerns or anything they want to ask. I also just want to mention that nationally, we've been running at level 4. They call it level 4s, level 1, level 2, level 3, level 4. Level 4 is the worst. And we've been running at level 4, which is a real kind of like command and control kind of agenda from the national picture. So it's very directed. We're told what we have to do. We're given instruction. And they've moved us from level 4 into level 3 in the last week. And we won't see an awful lot of difference, but it does mean that we can start to step things down. You'll see things changing nationally as well. They're opening up a few more things. And also it's based on the fact that there have been a reduction in admissions, a reduction in COVID cases, a reduction into intensive care units. So we've stepped into level 3 nationally. However, I just wanted to do a bit of a word of caution really on that for us internally and as an organisation, because there are still huge pressures on some of our services, particularly local mental health services at the moment. The amount of referrals going into the crisis teams, the increase in acuity of our patients, they're much sicker, more complex. And also that then results in a massive demand on our staff. So it was just really an acknowledgement that in some areas of the trust, the demand is huge still, very, very high, and the expectation of our staff is still there to work and deliver to these patients. And I really, it's just to say, watch out for it, be kind, respectful of that. and remember that some people are working under an enormous amount of strain. I think that probably is as much as I wanted to mention from our notices. I know that there's some questions come in, and I'll hand that over now to Alex.
Thank you ever so much, Anne-Maria. I know that there's been quite a few questions about the IT at the moment, and some issues around that. And I know that is Ivor on the call. If whether you're happy to say anything about that at the moment, Ivor, and give everybody an update, especially in relation to Outlook. Thank you.
Yeah, good afternoon, everybody. So I'm Ivor Nicholson. I'm head of digital services. So I am responsible for all the IT in the trust. So apologies for the issues that we've currently got with the Microsoft Outlook. The cause of our issue seems to have gone back to a week last Tuesday when we upgraded our firewall. We did it at 4 a.m. in the morning because we knew that most people wouldn't be disadvantaged at that time if we made those changes. Unfortunately, when we upgraded our firewall, it did bring the email service down. And what that means is that all the servers that run our email at Duncan Macmillan House, they sort of failed. As designed, that meant that the email servers that we have in our second data center at Rampton all came live, and so the email service continued. But one of the issues that we have is that I'm not going to say I'm new to the trust, because I'm not. I've been here 18 months, but I am finding some nuances for the first time as we make different changes within our IT. And what it seems to me is that we don't have sufficient connectivity between our two data centers. So whilst everyone was now trying to log on to email on Tuesday and access all their email accounts at our Rampton data center, it was also being updated from our Duncan Macmillan data center as well, because all your user account up-to-date information was at Duncan Mac. So it effectively doubled the traffic, and for most people, this has now sorted itself out, and I can see that from what's running across the network, the traffic for most people is operating normally. I am slightly concerned that we still have issues for some, and therefore I'm working with two companies at the moment. One's BT, who provide our firewall, to see whether or not any of the changes that we made with our firewall has had a knock-on impact on our email services. The other one is we're working with Microsoft and our Microsoft partners around whether or not there's anything that needs changing with our Outlook system. What I would say is that if you've still got issues, please do let the service desk know. If you need email essentially for your job, if we can't get it going, we will find a workaround for you. So please do contact the service desk. We've found workarounds for people that need them. That's the latest I have. So thank you.
That's great. Thank you ever so much, Ivor. Anne-Maria, was there anything else that you wish to say around that?
No, I'm just putting something in the chat box just to reiterate what Ivor said. They won't necessarily know that you're having problems with your computers, so you must contact the service desk, because like I said, we think we know how many people are struggling still, and it is a very small number, but we won't know unless they contact. So that was the only thing I wanted to add.
That's great. Thank you ever so much. We've had, I think, quite a timely question actually sent in, and Claire, I don't know if you wish to answer this. I note that NUH have given all their staff an extra day's annual leave as announced on their Facebook page, and I've heard of other trusts doing this as well in respect of everyone's hard work over the COVID pandemic. Just wondered if our trust had any plans for this for our staff. And I do acknowledge that we all had the £20 voucher, which was a lovely gesture also, and much appreciated. And this was sent in before this morning. Claire, thank you.
Thanks, Alex. And yeah, good question and really timely question. So yes, we are going to be acknowledging and have acknowledged everyone's really hard work and commitment by allocating an extra day of annual leave to people. That is pro rata, dependent upon the hours that people work, and also for bank colleagues it will be made in terms of a payment so that people can have some time out without losing out financially. So I believe that communication has gone out this morning and will be allocated to people for them to be able to access and take. And what we're really encouraging people to do is to use that time for themselves, take a bit of time out, get some rest and recuperation really, and to try to do that within the next few weeks, or certainly within the next couple of months or so. So that you get some time back and time for yourself, and just as an acknowledgement of our thanks. And so that is no coincidence that we've done that in line with the question. Administering these things is a bit more technical than people think, so we've had to make sure that the systems are lined up to make sure that people can get the allocation properly. So we've been looking at this for a couple of weeks or so as an exec team based on the feedback that we've had for colleagues, and I think that email's gone out today and we'll reaffirm that in onward comms. So hope that answers the point.
That's great. Thanks ever so much, Claire. And Michelle's put in the chat, yes, I got the email. I thought it was lovely and very much appreciated. And I know colleagues of mine within my team have said exactly the same, that they're really appreciating that. And it's just a lovely gesture. Thank you. With regards to the next question, moving on, it's regarding the staff survey. So I don't know if you want to take this, Claire. Again, in relation to the staff survey, I would like to understand how the overall scores for equality and diversity and inclusion have improved if the percentage of BME staff experiencing discrimination in the last 12 months has increased, and the gap between the percentage of white staff and BME staff in the organisation, believing there is an equal opportunity for career progression and promotion, has widened, and the trust is below average in both of these areas. Is this because it also takes into account the opinions of the staff least likely to experience discrimination? And if so, can these points be acknowledged whenever discussing the improvement score, as surely it's the opinions of the people experiencing these harms that need to be centred? Thank you.
Thanks, Alex. Well, that's a really thorough question, and a lot of information there in terms of answering that. So I'll do my best to cover the points off, but we'll say as well that we will be publishing further details and information around the staff survey that will feedback on all of those points. So at a high level, there are sort of 78 questions in the staff survey, and those questions are themed along 10 themes. One of them is equality, diversity and inclusion. Another one's around staff health and wellbeing, another one around morale, for example. And so those questions are collated into that so that we can analyse them at a bit of a higher level. And overall, for equality, diversity and inclusion, it showed an improved position. So generally, the responses were more positive in terms of people's experience. Well, there are 10 themes overall, and in 9 categories, we showed an improvement. What that means for us as an organisation is it brought our position to closer to the average of that of our benchmark group. So whilst it's an improved position, we're not complacent in that, and we still absolutely acknowledge that there's quite a lot of work for us to do. Along with the responses to the questions, we also get people also have the opportunity to feedback in terms of narrative, so to share some of their more personal experiences. And we receive those comments, and we also go through all of those. There are a couple of things. What we generally know from the feedback that we've got is that the experience of our BME colleagues is not consistent with that of our white colleagues. So it is not that experience is not as good as we would want it to be. We also know that our BME colleagues do flag with us the fact that they do feel that they are exposed more to discriminatory comments, both from colleagues and also from patients and service users, and that's something that just isn't acceptable. So whilst the feedback shows an overall improvement, we are very, very mindful of the work that there still is to do, and we do not accept that an improved position means that actually it's improvement across the board in all experiences for all of our colleagues, and that's the bit that we will continue to do the work on with people. In terms of getting into some of the further detail, a couple of things that we will do going forward. So we are engaging with everybody to think about, well, what next and what do people want us to focus on. There is the opportunity on the 19th of April, I think. Yeah, the 19th of April, we are holding an open forum for all colleagues to get engaged with. You can join that by emailing the staff engagement email address in the first instance. Those details went out in John's comms. We will put them in the chat and we will reissue those to say come in and join in the big conversation, really, so that we can share more of the detail on the staff survey and work with you in terms of co-producing what some of the actions are. That's the approach we took in the last couple of years, and that's worked really well around some of the big improvements that we've made around further developing the BME staff network, developing the health and wellbeing service, for example, and co-producing our trust values. And that's the space that we want to get into again this year to take that work forward. Sorry, I've not gone into all the absolute statistics on those responses, but we will publish those details in more details. And I think, Alex, you've probably just put something in the chat that answers those points. Hope that's helpful.
Absolutely, thank you, Claire. I've put the link in for the page on the staff survey on Connect, which has access to all of those statistics. There's information on there about the event as well, so just giving a bit more detail as well. So thank you both so much. Anne-Maria, we've got a question on lateral flow tests, and just wondering if you're able to respond to this, please. How reliable are the lateral flow tests? Some staff have continued to be ill with cold symptoms but are testing negative. Thank you.
No, thank you very much for that, Alex. Really, really good question. And I'm really happy that somebody's put it in, actually, because it gives me an opportunity to say a couple of things around lateral flow testing. You know, lateral flow testing is only as good as the person doing the test. So there is a technique, and it's really, really important that people do it properly. You must get a really good nasal swab. You must swill it around in the fluid. You must really, really condense it into the fluid to make sure that you get a really good sample. So that's the first thing, is that you need to do it really well. Secondly, yes, it is fairly consistently reliable. So it measures anything between 60 to 80% reliability. And what we're finding is that higher end of 80 to 85% reliability. Now, having chaired all of the outbreak meetings for this trust over the last, since March last year, I would say that we've picked up a good percentage of outbreaks based on the lateral flow testing coming back positive for asymptomatic staff. So the answer to this question around some staff who have continued to be ill with cold symptoms is slightly worrying, because if people still have any symptoms whatsoever, they shouldn't be relying upon lateral flow testing. What they should do is go and have a PCR test. So what my message today is very, very clear. Lateral flow testing is for asymptomatic staff. If you have any symptoms whatsoever that are connected to COVID, then you must go and get a PCR test. You can do that through the trust, or you can book yourself as a member of the public and go onto the website and then book yourself a slot. So that's really, really important. Don't wait and keep doing lateral flow if you've got any symptoms at all. The other thing that I think is a really important message is we've currently got 2 outbreaks that I'm looking after. One of those outbreaks we've got 5 patients, and what's come to light is that we've still got a very, very low number of staff doing the lateral flow testing in that outbreak. So, for example, only 4 out of 21 healthcare support workers are recording the fact that they've done the test. Now, I've had to have a very difficult conversation then with Public Health England, that National Public Health England, and also we had the National Infection Control lead on the call, who was then saying that, so Public Health England's advice yesterday was, if we had more staff doing lateral flow testing, we would then not need to do mass staff testing in outbreaks. So on one of those outbreaks, we are having to test 119 staff because they've not been doing their lateral flow testing. And I can honestly say to you, and this is hand on heart, we've picked up lots and lots of outbreaks based on positive lateral flows. And I know what people are saying is sometimes it's negative, and then suddenly it's positive. How can that be? But we incubate for a good 3 to 5 days. So it's rightly that you would be negative sometimes, and then rightly that sometimes people then become positive. But it's because we're very, very good at incubating this virus. So I hope I've made that clear. Please carry on doing lateral flow testing. Please carry on inputting the results. This will really help when we do have outbreaks. Yes, it's important if you are asymptomatic to continue to do your lateral flow testing, but if you've got symptoms, go and get yourself tested through the PCR test. So hopefully that's answered all of that.
That's great. Thank you ever so much, Anne-Maria, and that was, yeah, definitely very clear. Thank you. Claire, we've had a question with regards to vaccinations, and the question is, why are the over 50s being recommended to book before the end of this week only? Will there be no new appointments after this time? Thank you.
Thanks, Alex. No, appointments will continue, but what we're trying to do is encourage everybody who is eligible for a vaccination in cohorts 1 to 9, which included the over 50s and included all health and care staff, is to take up their vaccine as soon as possible, really, before we start to open up more widely to the other cohorts, which will be cohorts by other age groups. And it won't mean that you won't be able to get an appointment, but as we widen the vaccination opening to the over 40s, for example, there will be a whole influx of other people that will be eligible for a vaccine that will want one. So what we're saying is, whilst you're eligible and other people aren't, please book your vaccination as soon as possible. And if you are a member of staff, you are eligible for that vaccine. So please do book it and get your vaccine as soon as you possibly can. The other thing I'd just say on vaccinations, just while we're on it, it is bank holiday weekend for Nottinghamshire. So different geographies are doing slightly different things. So some people will have slightly different operating hours. For Nottinghamshire, the vaccination centres are open throughout. There are some reduced opening hours, but there are vaccination centres that are open on every day over the bank holiday weekend. So if you've not had your vaccine already, please take the opportunity to book in and get that as soon as you can.
That's great. Thank you ever so much, Claire. I've just put in the chat, and just to say that if anybody's got any questions, we've only had one further question sent in. So if there's anybody that's got any further questions, please don't be shy. Put those, add those in. And just while I'm talking about that, there won't be a meeting next week. Because of Easter, it being Easter week, John's asked that we don't have a meeting next week. So but if so, please, this is your opportunity at the moment. But Julie, I'll pose the final question that we've had sent in to date to you. NHS staff in Scotland are receiving at least a 4% pay rise backdated to December. In England, the government is suggesting a 1% increase. Is there anything NHS providers can do to lobby the government to rethink? Thank you.
What a question. The penultimate comments on the Q&A today. Yeah, so obviously, yes, we all saw the press coverage around Scotland. It was an interesting move politically, obviously. We all know that our pay is nationally negotiated. It's a national agreement. Our view as a trust is that we want our staff to be paid fairly for the role that they undertake. So I'm not going to say what I think or my mother thinks or my colleagues or everybody I meet at work, because I think we all know what we think about that. You can see my occasional retweets, I think, which will detect some of my thoughts about it. But yes, our overwhelming view is that we want our staff to be paid fairly for the role that they undertake. So at the moment, the professional bodies and the staff side bodies are lobbying, and that's to lobby the pay review body, who will be undertaking its own review and making its recommendation around the end of May. You know, given the year that we've had, we understand how staff feel, and that we encourage you, if you want to have a voice and your say around those negotiations, you do get in touch with your professional body. And but you know that these are our thoughts on the matter, and we are very well aware of how people feel about it, having had the unprecedented challenges that we've had over the last year. And on that note, I think, you know, Anne-Marie has alluded to some of the current sort of strains and stresses that we definitely still have with us and presently at the moment around access to services. And to say, you know, a huge recognition to colleagues for continuing in what they do. Also, we've got the bank holiday weekend coming up, and we know that people are absolutely going over and above to meet the challenges and demand for services. So, you know, as an organisation, we want to be very clear in underlining our thanks to you all. And if we could do something more on the pay settlement, I can assure you that we would. So, thank you.
That's great. Thank you ever so much, Julie. Carol Andrews has put a question into the chat, and I don't know who wants to address this first, but how do you feel about the current context, the move to level 3 and the easing of lockdown?
I'll kick us off and then others can join in. I'm all right about stepping down to level 3. I think that there comes a point where people can't keep going at that pace and at that level. And you get kind of like a bit complacency if we're not careful, because it's, oh, we're just still in level 4. So I'm all right about, number 1, stepping down to level 3, and I'm all right about easing of some of the lockdown. I think that certainly on the national calls that I go on, there's a massive outcry for people to be able to visit in hospitals, for people to be able to be with their loved ones at end of life, people to be able to be with their partners for scans, for maternity, in a midwifery. So I think, for me personally, I think it's right that we start to introduce those things, because I think it's a long time now for people not to have been able to access. And as you know, the care homes are opening up the ability to visit as well. So from my perspective, I think the easing of lockdown is good. I think stepping down to level 3 is good, but there is a word of caution about this, of course. You know, if we're silly, I've seen some of the news where we've seen all of those hundreds and hundreds of young people congregated in parks, and you know, that made me really uncomfortable. So it's almost like, yes, I agree with it, but it's how it's then done and how people receive it and do what they do with it. So I just feel that I have a real dilemma. I think it's the right thing to do, but in a way that's done sensibly. Do my colleagues have anything that they feel, Julie?
Yeah, I mean, similar to Anne-Marie, really. I'm obviously in my role very cognizant about the surge that followed the last lockdown and the demand for services. And do some work regionally about the impact of people not accessing broader services for diagnoses, particularly around physical health conditions. And there's a lot of work to restore services, and I think that will place a lot of demands on us and broader health services. So I'm quite mindful of that. I think I feel quite positive about the the stepping down and sort of the economy resuming, and I think, you know, the impacts that economy has on our health and all of our social circumstances and things like that, I feel quite positive, but at the same time I personally feel quite anxious. I've just had 2 days off, and during the 2 days it's beautiful weather, and 2 people came and sat in my garden. But I actually feel, I don't know, it's amazing, isn't it? 2 people sitting in your garden. But I actually feel quite anxious about it, for myself, and my family and people I work with and the broader community. And, you know, seeing some of the things that Anne-Marie referred to in the media, I feel quite hostile about some of that. But, you know, a real mixture of emotions, really. So, yeah, positive, but with quite a lot of trepidation, I feel, and you know, I sort of cognizant of people who haven't been out and about like we have, and what impact that, you know, they will be feeling, and children going back to school, I just think has been a sort of microcosm of the way that everybody else is going to be feeling as well, and that sort of quite anxiety laden time that has been for people. So yeah, positive, but with some anxiety mixed in with that, I feel.
Claire?
Thanks for that. And yeah, my comments are completely aligned to what both Anne-Maria and Julie have said. What I would add, I was talking with colleagues just yesterday actually, and reflecting that this time last year, going into the Easter break, we were very much at the starting point of the pandemic. A lot of unknowns. We were ramping up the incident level actually, and we were just setting up the staff COVID-19 support infrastructure to support with all things testing, and there's been a whole host of things that have happened along the way. And I think for me, so I'm really hopeful. I personally love the outdoors, so the ability to get out and have a sensible level of socialisation and be with people, I think is really important. Accepting that I think we do need to continue to be sensible, and biggest reflection for me is we've still got a lot to learn about the virus and how we live with it and how it works and how we need to adjust. But we know so much more than we did this time last year, and it's really, really important that we use all the information that we've now got and have all those resources in our kind of kit bag to enable us to really function and function safely. So, you know, we've talked on this call alone about doing the things that we can do to keep ourselves as safe and as well as we can, physically and psychologically. Make sure that we still engage with all the testing facilities, wear the PPE, socially distance, don't crowd into confined spaces, and take the vaccine that's available to you. That's a whole different position to manage what we've got than where we were at 12 months ago. So I think it's hold on to what we've got and what we know, and let's all use it wisely, are my reflections really.
That's great. Thank you ever so much, Claire. And while I've got you on screen, Natasha has put in a question with regards to what support is being put in place for redeployed staff returning to their substantive roles.
Yeah, great question. Thanks, Natasha. Redeployment means so many different things to people across this trust, because people have been redeployed into so many different roles at different kind of levels with different asks in different sites. Some is about redeployed onto some different duties, still working in pretty much the same way and in the same team as people were before. So it means a whole host of different things. We want to make sure that the support is right for people. So if you are being redeployed and returning to your substantive post, you should be having those conversations with both your interim line manager and your substantive line manager to work through how that can be managed to support you and what that looks like. It may be, for example, that for certain staff, we do need to allocate a bit of extra time for people to refamiliarise themselves with team colleagues, and also some of the skills that you might need to pick up. You might need to revisit some aspects of mandatory training that you've not done. So we might need to think about allocating time for you to do that, time for you to socially interact and engage with people that you did work with, that you've not worked with, but that you've not worked with for some time. So again, to support that activity as well. And things may have changed in your substantive role. So you need that reorientation space and time, which is really important. And it's the same principles really that should be adopted, and we will absolutely encourage this, as to when people have been out of the organisation for other reasons, whether that's maternity, paternity leave, adoption leave, whether it's long-term sickness, absence. So where you've been away from your substantive job for some time, you should use a whole kind of reorientation approach into that and talk that through. I can't be more specific than that, I'm afraid, because it means it's quite different for different people depending on what they've been redeployed from to. But we'll put out some further guidance on that as well, just to reaffirm those points.
That's great. Thank you ever so much, Claire. Just going back into the chat, Mark Howells had, and going back to the first question as well, Mark Howells had put in the chat, I can't make the meeting, but just want to say a thank you on behalf of the R&E department for the additional day of leave. So thank you. I think that's great. Thank you ever so much. Are there any final comments that anybody would like to make?
Yeah, Alex, I'm just going to mention a couple of bits. I wanted to, I know that we've talked about it before, but I wanted to give a bit of a shout out to Simbi Sabanda. I actually think she might be on the call. Simbi has a hugely important role in the trust. She's our Freedom to Speak Up guardian. It's a massively important role for all trusts to have a Freedom to Speak Up guardian. It actually started on the back of the Francis report. I don't know if many of you remember, but he made 400 recommendations. And it was on the back of people not feeling they had somewhere to go to talk to somebody if they felt concern about patient care or experiences that they saw around patients. And so that role was brought in 2003. Actually, the role was kind of like discussed for the first time and brought in. And this organisation has taken that really seriously. We also have something called, at the moment, we have something called champions, Freedom to Speak Up champions. They are kind of like people who are passionate about that area in all the clinical divisions. So Simbi has contact details are on Connect. And I want to encourage people to, if they feel that there are areas of concern or areas that they feel are not quite right, or they want somebody to talk to, you know, that is her role. That is what she is there for. And she's really, really good. She's really approachable. She's very understanding, and she really gets it. She really gets how important this agenda is. Now, I talk about this on the back of something called closed cultures. Sometimes you will hear that, or you'll hear about people saying, I don't know where else to go, or, you know, I'm frustrated, or I'm not sure what to say. So I just wanted to say that closed cultures is where people feel they've got nowhere to go, where you absolutely do have somewhere to go in this organisation. You absolutely do. We've got a whole range of people, but I've highlighted Simbi's role as the most important. But of course, you've got line managers, you've got people, other people you can go to. We've got a fabulous, fabulous health and wellbeing team who are passionate about health and well-being, particularly for staff if they're struggling at the moment. We've talked, Julie and I have talked about the demand on staff at the moment. You know, we do have that ability within the organisation for staff to go to. In the olden days, when I was a youngster, there was only occupational health, and they weren't the easiest people necessarily to always go to. But trusts have taken it really seriously. And like I said, we are very lucky in this organisation, led by Tracy Orlandi. So I just wanted to a bit of a shout out, really, to some of the support that is out there for staff to access if you are in any difficulty at all. Oh, thank you for putting that in, Tasha. That's really helpful. Really, really helpful. Is there anything else anybody else would like to add at all? I can't see any hands up. Oh, I can see a hand up, Claire.
No, it was just to reaffirm. I know from all of us that we've going into bank holiday weekend. I know Julia sort of mentioned it as well, but just a thanks from me, and to reiterate, I'm really grateful for everyone's continued hard work. I know people will be working over the bank holidays as well, and we do appreciate all of that. But just to also say to people, please do try and get some times for yourself and your family, and yeah, make sure you look after you.
Yeah, that's lovely. I think that's a really lovely message to be finishing with then. Alex, is there anything else from you?
No, that's absolutely fantastic. Just encourage people to have a look at the page on the staff survey results and the video from John as well that's on there, that people can. It went out in his in your email yesterday, Anne-Maria. But if anybody's got any comments at all about anything that they want to see from that, please email staff engagement as well. But I really encourage people to have a look at that video. It's really good. Thank you.
So I think that's about us done then, everybody. So try and get some a break over the Easter break, and once again a huge thank you to everybody. Take care.